Hello, my name is Dr. Selva. I'm a consultant obstetrician and gynecologist and fertility specialist at Mahkota Medical Center, Malacca, Malaysia. In this video, I will discuss the benefits of high-intensity focused ultrasound or HIFU for fibroids and adenomyosis. This is the outline of this video lecture. History of HIFU, types of HIFU, what is HIFU, how is HIFU performed, is HIFU safe, what diseases can be treated with HIFU, what are the advantages of HIFU, how well accepted is HIFU around the world, is HIFU effective for fibroids, is HIFU effective for adenomyosis, what are the complications of HIFU, does HIFU affect fertility, what is the fertility outcome after HIFU, which patients should be excluded from HIFU treatment, what is the future of HIFU for fibroids and adenomyosis. History of HIFU. Lin et al. Proposed the concept of HIFU in a paper published in the 1940s. The Fry brothers then confirmed this technique might be used in clinical practice in Illinois in the 1950s. However, the technique was not developed at that time because of inadequate targeting methods. In 1988, a study of the biological effect of ultrasound was done. In 1996, the hypothesis of biological focal region or BFR was proposed in the 5th Symposium of the Academic Association of Sonochemistry of Europe. Biological focal region BFR is proposed relative to acoustic focal region or AFR, that is an elliptical coagulative necrosis in tissues caused by energy deposition of the single exposure of HIFU. Here you can see the BFR in the tissue. The amount of ablation will depend on the power used in the tissue. In 1997, Professor Wang Zebiao published a paper entitled Targeted Damage Effects of High-Intensity Focused Ultrasound HIFU on Liver Tissues of Guizhou Province Mini Swine in Ultrasonic Sonochemistry. In 1997, ultrasound HIFU was used to treat malignant bone tumor. An 18-year-old patient who underwent HIFU treatment for osteosarcoma in the left tibia. The patient had 2 cycles of chemotherapy with good response. However, the patient still had a focal area of increased uptake with the technetium methylene diphosphate tracer. Pre-HIFU images showed focal area of increased uptake that corresponded to the local abnormality. 2 weeks after HIFU, the tracer uptake of the treated tumor disappeared completely in the treated region. Research in using HIFU was done at the Oxford HIFU unit and CE mark was obtained for liver treatment in 1995. The first purpose-built HIFU unit was officiated in 2002. Here we can see Professor Wang Zebiao and Professor David Cranston at the HIFU unit in 2002. Types of HIFU. There are 2 types of HIFU, namely MRI HIFU and ultrasound-based HIFU. Both ultrasound-based HIFU and MRI-based HIFU uses focused ultrasound beams to treat the disease. The difference is the imaging modality used to look at the organ. In MRI-based HIFU, MRI is used to look at the organ, whereas in ultrasound-based HIFU, ultrasound is used to look at the organ. The first FDA-approved MRI HIFU is X-Blade 2000, approved in 1998. In 2004, FDA approved X-Blade 2000 for use in fibroids. In Europe, Philips made the Sonalef MRI HIFU, which has the CE mark. The leading company making the ultrasound-based HIFU is the HIFU company from Chongqing, China. They have 3 models, JC, JC200 and JC200D. This table shows the advantages and disadvantages of the 2 different types of HIFU. The advantage of MRI-based HIFU is that the anatomic resolution is very good. MRI-based HIFU can also measure the temperature of the tissues being ablated. The advantage of ultrasound-based HIFU is that it is performed in real time. This means that the doctor is actually looking at the tissue while treatment is being done. MRI-based HIFU is not done in real time. MRI-based HIFU is good for static organs like the brain, whereas the uterus is a mobile organ and we need real-time ultrasound images to treat it. Since the space in the ultrasound-based HIFU is more than the space in the MRI-based HIFU, the movement of the transducer is more in the ultrasound-based HIFU, and so more area can be covered by ultrasound-based HIFU. As a result, ultrasound-based HIFU is more effective in treating diseases such as fibroids and adenomyosis than MRI-based HIFU, with a higher success rate of treatment. Success rate is determined by the non-perfusion ratio, which is the ratio of the amount of tissues ablated compared to the amount that is not ablated. Ultrasound-based HIFU can reach up to 80 to 90% NPV compared to only 20 to 50% with MRI-based HIFU. Positioning of the patients is also easier with ultrasound-based HIFU. The duration of treatment is also shorter in ultrasound-based HIFU. It takes 1 to 2 hours to perform an ultrasound-based HIFU surgery compared to 3 to 4 hours with MRI-based HIFU surgery. MRI HIFU is also more noisy and more claustrophobic for the patient compared to ultrasound HIFU. Finally, MRI HIFU can be performed only by interventional radiologists, but ultrasound-based HIFU can be performed by anyone who can do ultrasound, including a gynecologist. What is HIFU? High-intensity focused ultrasound HIFU uses sound energy to focus a high-intensity ultrasonic beam to thermally ablate abnormal tissue cells with minimal injury to intervening tissues. It is a non-invasive, organ-sparing thermal ablative procedure. We all know that a magnifying glass can be used to focus sunlight to create heat and burn a hole in a leaf. In a similar manner, ultrasound energy can be focused on a tiny spot, causing destruction of the tissue. HIFU is performed under precise imaging guidance. It causes destruction of tissues by two methods. Firstly, it causes the temperature of the tissue to be raised to 60 to 100 degrees Celsius, causing thermal ablation of the cells. Secondly, HIFU causes pressure waves in the tissues, causing the tissue to vibrate, leading to mechanical cavitation and stress to the cells, leading to cell death. How is HIFU performed? In this animation, one can see how HIFU works. An ultrasound beam is brought to a focus and causes destruction to a small area which is the size of a grain of rice. The focus is then moved from one point to another until a line is ablated. It is then moved to another area below it and a slice of the tissue is ablated. When many slices are ablated, a volume will be ablated. Here a nodule in the liver is being ablated. Using ultrasound, the nodule is sliced into many slices. Each slice is ablated and then the whole lesion is ablated as shown here. This is another video showing ablation of a fibroid. The ablation will show a white area on the screen. The focal point is then moved and ablation is done. This is then moved and the whole lesion is then ablated. This video explains how HIFU works.
An ultrasound beam can be brought to a tight focus at a distance from its source, with sufficient energy concentrated within the focus. The cells lying within will be killed without damaging the surrounding tissues. High-intensity focus ultrasound, HIFU, is, therefore, a non-invasive method of producing selective and trackless destruction of deeply seated tissue targets within the body, without causing any damage to the overlying surrounding tissues. Ultrasound-guided HIFU involves HIFU ablation under the guidance of real-time ultrasound imaging, which can achieve an uninterrupted visualization of tissue coagulative necrosis during the treatment via grayscale changes in real time. The ablated lesions demonstrate an echogenicity or grayscale changes in the ultrasound images after the sonication, which enables immediate assessment of patients' response to ablation, ensuring a safer and more controllable therapy. Imaging fusion and three-dimension digital reconstruction function provide doctors with a much clearer vision during the whole procedure. Thus, doctors can finish the treatment with ease. Ultrasound-guided HIFU, a new option for the gynecologist to manage uterine fibroids and other gynecological benign tumors, can maximally preserving the integrity of the uterus. No surgery, no bleeding, and no anesthesia. Patients can even chat with doctors during treatment to ease their tension. Patients can go home in merely 2 hours after the treatment and resume normal life the second day after treatment. post-operative MRI may still detect the presence of ablated lesions. However, vascularity is now absent in the ablated region, as the ablated lesions will gradually shrink or even disappear over time. The symptoms will also be gradually alleviated or eliminated. Ultrasound-guided HIFU for gynecologists.
Is HIFU safe? In this video, we can see the safety of HIFU. HIFU is being used to cause a burn in the plastic plate, but there is no injury when the hands are placed along the path of the HIFU beam. In this video, we can see how precise HIFU treatment is. The word China or Chongguo is written on the monitor and the word is burned into the ox liver. On slicing the ox liver, we can see how the word is precisely written into the liver. What diseases can be treated with HIFU? HIFU can be used to treat many diseases: the uterus, breast diseases, liver diseases, pancreatic lesions for pain control only, kidney diseases, bone diseases, and soft tissue diseases. In gynecology, it can be used to treat fibroids, adenomyosis, placenta accreta, caesarean scar pregnancy, and abdominal endometriosis. What are the advantages of HIFU? High-intensity focused ultrasound or HIFU is performed by focusing an ultrasound energy to a tiny spot causing destruction of tissue. It can be used to shrink fibroids and adenomyosis. Mahkota Medical Center will be the first hospital in Malaysia to introduce the ultrasound-based HIFU from Chongqing, China. There are many advantages of HIFU. It is a minimally invasive therapy. There is no scar in the abdomen. It is not done under general anesthesia. It's only done under light sedation. The patient will not suffer from any blood loss and there will be no blood transfusion. The patient can communicate with the doctor all the time while the procedure is being done. The patient only suffers from minimal discomfort after the procedure. She can return home after the sedation has worn off after about 6 to 8 hours. This is a 360 degrees photograph of the HIFU Center in Mahkota Medical Center, Malacca, Malaysia. There are many advantages of HIFU to treat fibroids and adenomyosis. It is a non-invasive treatment with no surgical scars. It is an organ preservation surgery. There is no blood loss and blood transfusion is not necessary. It is not radiation but using only ultrasound to treat the disease. It is a day care procedure. Patient has a quick recovery and can resume work. It is precise in its ablation. It is done under sedation and general anesthesia is not necessary. Patient is also comfortable and relaxed during the procedure. There are very few complications with HIFU surgery. How well accepted is HIFU around the world? Currently, there are 29 countries in the world with this machine. There are more than 250 centers in Asia performing HIFU using the HIFU company's machines. There are also more than 10 centers in Europe. More than 180,000 cases of HIFU has been performed. The Chongqing HIFU company has a strong academic relationship with many academic institutions such as the Oxford University, the Frankfurt University Hospital, the Bonn University Hospital, the Queen Mary University Hospital in Hong Kong, and Chang'an Memorial Hospital in Taiwan. This is the HIFU Center in the John Radcliffe Hospital, Oxford, UK. This is the University Clinics in Bonn, Germany. This is in the University Hospital, Frankfurt, Germany. This is a center in Spain. These are centers in Hong Kong. There are 6 centers in Taiwan, including Chang'an Memorial Hospital and Kaohsiung Medical University. There are centers in Russia, Kazakhstan, and Ukraine. There is a center in Egypt and in Johannesburg, South Africa. This is a center in Bulgaria. There are more than 20 centers in Korea. I visited 4 of the centers in 2018 before I decided to bring in the HIFU machine to Malaysia. Is HIFU effective for fibroids? There are numerous publications of HIFU for different diseases. These are divided into MRI HIFU and ultrasound HIFU. More than 52% of the publications are using machines made by Chongqing HIFU company. These are some of the publications. I will highlight just one paper here. This study was performed at the First Hospital Chongqing Medical University between 2006 and 2009. 757 patients were treated using the ultrasound-based HIFU. This table shows the patient characteristics. The average age of the patient was 38.5 years. The symptom severity score was 58.7. A total of 1,114 fibroids were treated. 293 were submucous, 668 were intramural, and 153 were subserosal. The average volume of the fibroids were 136.7 cm cube. The non-perfusion volume ratio, which is the ratio between ablated and non-ablated areas after treatment, was 84.8%. This graph shows that 92.5% of the patients showed symptom improvement after 3 months of treatment. This graph shows the rate of fibroid shrinkage after HIFU treatment. The volume of treated fibroids at 3 months was 31.2%, 6 months was 58.6%, 12 months was 70.3%, and 24 months was 82.8%, and 36 months was 89.7%. Is HIFU effective for adenomyosis? The first patient with adenomyosis that was treated with HIFU was in 2007. She was a 37-year-old patient who presented with severe dysmenorrhea and menorrhagia. The size of the adenomyosis was 5.1 times 6.7 times 8.0 centimeters. HIFU was performed. The room time was 1 hour 5 minutes and the sonication time was 9 minutes 20 seconds. The average power used was 199 watts. After treatment, all the symptoms were gone. This is a study published in the journal Ultrasonic Sonochemistry. Between January 2010 to December 2011, 350 patients with adenomyosis from Swining Central Hospital, Fuling Central Hospital, and 3 Gorges Central Hospital were treated with HIFU. 224 patients completed the 2 years follow-up. The inclusion criteria were: diagnosis of adenomyosis was confirmed by MRI in all patients. The wall of the uterus was thicker than 3 centimeters. Patient is unwilling to have a hysterectomy. This table shows the characteristics of the 350 patients with adenomyosis treated with HIFU. Average age of patients was 41.6 years. Size of adenomyotic lesion was 5.1 centimeters. Volume was 66.2 centimeter cube. Size of the uterus was 9.8 centimeters. Volume of the uterus was 253 centimeter cube. Thickness of uterine wall was 4.6 centimeters. Thickness of junctional zone was 4.3 centimeters. HIFU ablation parameters are as follows. Treatment time was 103 minutes. Sonication time was 1,197 seconds. Treatment intensity was 689. Average power used was 379 watts. Non-perfused volume was 49 centimeter cube. NPV was 72.7%. This table shows the evaluation of treatment efficacy in 203 patients with dysmenorrhea after HIFU treatment. After 3 months, 84.7% showed relief. After 1 year, 86.2% showed relief. After 2 years, 82.3% showed relief. This table shows the treatment efficacy in 109 patients with menorrhagia after HIFU treatment. After 3 months, 79.8% showed relief. After 1 year, 80.7% showed relief. After 2 years, 78.9% showed relief. What are the complication rates of HIFU? This study shows the complication rates of HIFU in 9,988 cases. The complication rates were reported as 10.6%. However, in 94.1%, it was minor, such as vaginal secretion, lower abdominal pain, leg or buttock pain, hematuria, and uterine bleeding. Skin burns occurred in 0.26% of patients. The most serious side effects is intestinal perforation, and this was seen in only 2 patients, indicating that HIFU is safer than any form of surgery. This slide shows skin burn. Patients with multiple scars have a higher risk of skin burns because the scar absorbs the sound waves. Does HIFU affect fertility? In this study entitled Changes in Anti-Mullerian Hormone Levels as a Biomarker of Ovarian Reserve After Ultrasound-Guided High-Intensity Focused Ultrasound Treatment of Adenomyosis and Fibroids, the study showed that there is no significant difference in the level of AMH before and after HIFU treatment. This study showed the pregnancy outcomes in patients with uterine fibroids treated with ultrasound-based HIFU. 78 patients conceived after HIFU and there were 71 live births. The conclusion was that HIFU treatment can effectively treat patients with uterine fibroids who wish to have children. It could significantly reduce the preparation period for pregnancy after operation. It can also improve the fertility of patients with a history of infertility and abnormal pregnancy and childbearing with no additional obstetric risk. When we perform myomectomy, the incision is made in the uterus to remove the fibroid. The uterus is then sutured. Usually, we ask the patient to wait for 6 to 9 months before attempting pregnancy. There's always a worry of uterine rupture if the patient conceives, and usually the patient will undergo a cesarean section. With HIFU, there is no incision in the uterus. As such, the patient can start trying to conceive earlier, that is after 3 months of HIFU. Also, because there is no scar in the uterus, the patient can have a normal delivery. What is the fertility outcome after HIFU? Rika Bov et al. In 2006 reported a 36-year-old patient with a 84 cm3 focal adenomyotic lesion who had difficulty in conceiving. After one session of MRI HIFU treatment, a non-perfused volume of 33 cm3 was achieved. The patient reported a significant reduction in menorrhagia and a remarkable decrease in size of the lesion after 6 weeks. The patient conceived spontaneously and delivered a healthy term infant vaginally. In 2016, Zhou et al. Completed a follow-up of 68 HIFU-treated adenomyosis patients who wished to conceive. Of these 68 patients, 54 conceived at a median of 10 months range between 1 and 31 months post-HIFU. And of these, 21 delivered healthy babies. No uterine rupture occurred during gestation or delivery. From April 2011 to February 2016, in Chongqing, China, 52 adenomyosis patients who wanted to conceive after HIFU treatment were followed up. 20 conceived with a median age of 8.75 months after HIFU. 11 delivered healthy babies at term. There was no uterine rupture. This is a case of a 26-year-old lady, Miss Wang, who presented with dysmenorrhea for 10 years. The symptoms were worst over the last 1 year. Dysmenorrhea starts 1 to 2 days before the menses until 1 to 7 days after. The most severe pain lasted for 1 to 2 days, and she was unable to get out of bed to work. She was married for 3 years without pregnancy. Sonication time was 671 seconds, room time was 111 minutes, NPV was 51%. This slide shows the uterus before and after ablation. 2 months after HIFU, she conceived but miscarried. She conceived again after 4 months and delivered a full-term baby. The next case is a 33-year-old patient who had dysmenorrhea for more than 10 years. Sometimes the pain has to be stopped with painkillers. This slide shows the posterior adenomyosis before and after ablation. Sonication time was 1,838 seconds. The room time was 160 minutes. The NPV was 51%. Dysmenorrhea was significantly relieved 2 months after HIFU. She conceived 6 months later and delivered a full-term baby. Which patients should be excluded from HIFU treatment? Cervical tumor, as there is a risk of contraction of the cervix during HIFU treatment. Interposition of bowel in the ultrasound beam path. Extensive cutaneous scars. History of lower abdominal surgeries, which may cause difficulties in exposing the lesion. History of uterine surgeries in the last 3 months. Uncontrolled comorbidities such as hypertension, history of stroke, connective tissue diseases or radiotherapy. Leiomyosarcoma. Patients who cannot stay still for more than 1 hour. Future of HIFU for fibroids and adenomyosis. This is a review paper I published recently. In this review paper, I discussed that small intramural fibroids measuring 3 centimeters can cause a lady to have difficulty in conceiving. To perform a surgery for such small fibroids seems unreasonable. Performing HIFU on these small fibroids and shrinking them will be a good alternative to surgery. This will be my area of research. GnRH analog and HIFU. GnRH analog can be given before HIFU treatment to make the HIFU treatment more effective in patients with adenomyosis. This will be another area of my research. It is well known that HIFU does not work if the tumor is vascular. Dr. Kim from Korea does uterine artery embolization for vascular fibroids and then does HIFU on them to get a better result. I want to see whether this principle can be applied to adenomyosis. For patients with endometrioma and adenomyosis, Dr. Choi from Korea does HIFU for the adenomyosis and followed by transvaginal aspiration and sclerotherapy of the endometrioma. I want to see if I can do HIFU for adenomyosis and then perform laparoscopic cystectomy and excision of all the nodules in the pelvis in patients with both endometrioma and adenomyosis. In conclusion, HIFU is a revolutionary technology. It is also a disruptive technology. Currently, more women are choosing minimally invasive surgery over open surgery for fibroids. In future, more women will choose non-invasive procedures such as HIFU over surgery for fibroids. There is hope for patients with adenomyosis. Patients with adenomyosis suffer the most and ultimately have to undergo hysterectomy. In such patients, HIFU will help to prevent a hysterectomy and give them a chance of pregnancy. Thank you.